Thank you very much, Dr. Maharaj. Indeed, much to consider, much to attend to as we continue to work against child sexual abuse. But key, realizing, recognizing, responding, and cultivating awareness. And for us involved in this work, be wary of compassion fatigue and embrace self-care. Up next, we have another presentation that's going to prove to be just as educational and enlightening from Dr. Korinne Louison, The Implications for Education of Child Sexual Abuse. Please welcome Dr. Louison.
Thank you. Good morning, everyone. First, I'd like to thank Dr. Raddock, Dr. Primus, and the organizers of this very important symposium for inviting me to talk about the educational implications of child sexual abuse. When I was approached to do this presentation, I thought I had been given a really interesting challenge. And I say that because my research interests are in intelligence, right? Individual differences in intelligence and the implications for academic achievement. But I'm particularly interested in how developing frameworks can help us understand not only how and why children develop differently, but also help us predict how well children can do at school, or how well children will do at school. And also, these frameworks can help us better focus our interventions, how we treat with children if we want to see them perform to their fullest potential. So I thought it might be very useful for me to approach this topic from that perspective. Building a model or building a framework that can help us understand why children who have been sexually abused tend to perform the way they do at school. And I'm really hoping that this discussion will have some relevance for most of you, for all of you who work with children. So whether you're a teacher or a social worker or a guidance officer or even psychologists who work within the education system, that this is going to have some relevance. And so today I will be talking about the educational outcomes for children who have been sexually abused and what is the relevance of this knowledge for practitioners who work in education. So I'm going to talk today about what the literature is saying about the relationship between child sexual abuse and academic outcomes. How do children who have been sexually abused tend to perform academically? It will also be important for us to understand why we tend to see these associations between sexual abuse and academic outcomes. So not only whether these associations exist, but why we tend to see these associations. And also, once we understand why these associations exist, once we understand the mechanisms by which these associations tend to come about, how do we apply this to practice? How do we take this knowledge and apply this to our work as we seek to improve educational outcomes for children who have been sexually abused? So what is the data telling us? Well, based on studies that have been done, we see that there seems to be a significant correlation between sexual abuse in children and their academic outcomes. What we know is that the earlier the onset of the abuse, right, and the longer the duration of the abuse, the more likely are children to experience these academic difficulties. What I want to do is I want to refer to a study that had been published earlier this year. And this study had been done by Fry and his colleagues. And what they did was they pulled together data from over 100 studies from 21 different countries. And they were looking at certain negative academic outcomes. So they were looking at school dropout rates, they were looking at graduation rates, and they were looking at actual academic performance. So they were looking at things like school grades or even performance on standardized tests of academic achievement. And what they found was that there was a significant effect for sexual abuse on these negative outcomes, meaning, if you look at the graph, you'll see that children who have been sexually abused tend to have a greater risk of dropout, right? They also tend to have a greater risk of missing school, absenteeism. So we see here on the graph that males tend to be twice as likely compared to their peers to miss school. Females tend to be 3 times as likely. Okay? And also, children who have been sexually abused tend to have display or demonstrate lower academic performance. So they tend to perform worse at class tests, and they tend to perform worse on tests of standardized achievement, standardized tests of achievement. So how do we make sense of this connection? Because the data is showing us that there is indeed a link between sexual abuse and these academic inequalities. So how do we make sense of it? So for practitioners, we want to know why. Okay? So it's one thing to know, but if we are going to have some effect in our work with children, we need to know what are the factors that explain these inequalities. All right? So I'm going to refer to studies that have been generally critical of these sort of correlational studies. And the general criticism of these studies is that they do not account for context, right? Environmental context. So what they're asking is it that children who are sexually abused simply based on the fact that they've been abused, tend to perform worse at school or function worse at school? Or is it the environmental context in which they exist that explains their difficulties? So what they did was ask that question. They proposed a model which suggests that if we are to work with children who've been sexually abused and who are having difficulty at school, we need to factor in their environment, right? And we also need to focus our interventions on their environment. So they tested this hypothesis, and what they found was that this was indeed the case. That when they entered these environmental variables into the model, they found that it had a significant impact on academic achievement. So what are these factors that they identified? And these factors are what we call environmental risk factors. And I just want to talk briefly about that, because first of all, children who live in, regardless of whatever circumstance they live in, are vulnerable to abuse. Okay, that's first. However, research has identified certain risk factors, environmental risk factors, that make children more vulnerable to abuse. So what did these researchers identify? Well, they identified the age of the mother at the birth of the child. So the younger the mother is, the more vulnerable is the child to abuse, but also the child has a greater risk of poor academic achievement, okay? the education of the parent. So the lower the level of education of the parent, again, there's a greater risk. This is a risk factor, but there's also a greater risk of poor academic functioning. So you would probably be able to think in your work with families in that situation, what are some of the factors that might influence that? So inexperienced parenting, for example, or inability of the parent to provide academic support at home. Okay? So there are factors that may explain why we tend to see this correlation. What is another risk factor? Socioeconomic status. So another risk factor, children who grow up in low-income environments tend to have a greater risk. This is what research is telling us, and they also tend to perform poorly at school. Now, what is the reason for this? Now, there are many reasons. So we find that children who grow up in impoverished circumstances may have problems with nutrition, proper nutrition, poor prenatal care. Maybe the environment may not be intellectually stimulating for different reasons. Maybe there aren't the kinds of resources that the child may need in the environment to develop cognitively. Okay, so this is also an important risk factor. Parental changes. This is an interesting risk factor. So what research is telling us is that the instability within the home in terms of the parental arrangement, this is also a risk factor. So children who change maybe foster care arrangements regularly, or who see a regular coming and going of living partners. That is a risk factor. But it's also a factor that is likely to cause a certain amount of disruption within the family life. And this is something that can negatively impact on their ability to focus at school, ability to attend school. And finally, we're going to talk about parental alcohol and drug use and parental violence, domestic violence. So these are risk factors, and these are also factors that can cause disruption in their lives, that could affect their ability to focus on school. But there's also a component here of worry and the trauma that is likely to impact the development of the child. And I'm going to talk about that a little later. So we have the beginnings of a model that is helping us explain why we tend to see these links between sexual abuse and difficulties at school. And this is very useful for us because if we are going to design interventions, we want to work with the individual child, but we also want to focus on interventions that target their living situation, their contextual situation, environment. Now, there's another body of research that is telling us that there's certain, there's an impact of abuse in general, sexual abuse, and I'm talking about the trauma that is associated with abuse that impacts the cognitive development of the child. And what this research is telling us is that trauma seems to have an impact on brain development. Okay, so the earlier children are exposed to abuse, and the longer the duration of abuse, the more significant the impact on the brain. Okay, and this impact can be physical, and it also can be chemical. All right. So let's talk about the physical development of the brain. It seems like trauma, the earlier children experience trauma, it impacts the growth of the brain. So you will hear a term called neuroplasticity, and some of you may be familiar with the term. And neuroplasticity simply refers to the capacity of the brain for growth. Okay? And we find that children aged 0 to 3 years have the greatest, highest neuroplasticity. In other words, the brain, that is when the brain is most susceptible to growth. Okay? So you would understand that a child who has been exposed or has experienced sexual abuse within 0 to 3 years, their brain is more susceptible to the damage or the changes brought on by the trauma. Right? As they get older, the neuroplasticity starts to taper off, so that we know that children aged 0 to 3 years are most vulnerable. Okay? What do we also know? We also know that if we were to do studies like neuroimaging or MRIs on the brains of children who've experienced trauma early and have also experienced a long period of trauma, sexual abuse, tend to show that brains have smaller volume. So they have lower cranial volume, right? And this suggests that the trauma is somehow inhibiting the brain's ability to grow, right? At the rate that it should be expected to grow, okay? So you would imagine that if the brain is not growing or developing properly, then we're going to have some impact on functioning. And I'm going to talk about cognitive functioning, because this is the area that I think is most relevant to the academic achievement. So what do we know? We know that it can impact the frontal lobe, and that is the part of the brain associated with attention, right? Planning behavior, organizational skills, so those higher order cognitive processes, reasoning ability, problem-solving skills. So it impacts that, okay? It also impacts that green area, which we call the parietal lobe. And that part of the brain is associated with sensory processing. How do we process information that is coming in from our environment? Through our eyes, through our ears, smell, touch, taste. How do we process that information, and how do we integrate all that information? And finally, the temporal lobe. That part of the brain is associated with memory, right? Speech, language, auditory processing. So those of you who are interested in intellectual ability, cognitive skills, or cognitive ability, and its impact on academic achievement, would see that if there is an inhibition or a stunting of growth in that area of the brain, it's naturally going to affect academic achievement, because we know things like reasoning ability is important to academic achievement. Memory is important to academic achievement. Ability to process information, language, okay? So we are seeing here, based on these studies, that this can severely, seriously hamper this child's functioning in an academic setting. Now, Dr. Maharaj had spoken about the psychological consequences. So I'll just touch on that very briefly. And we know that the trauma impacts the balance of neurotransmitters, chemicals in the brain. So we're looking at chemicals like dopamine. There seems to be an overproduction of dopamine, and that's associated with attention. So we know in attention, the ability to focus, the ability to filter out information, filter out what is most important, what's not important, is important to learning. So we talk all the time about the child's capacity to focus within the classroom. So this is impacted. And serotonin. Dr. Maharaj talked about depression, PTSD. So serotonin associated with anxiety, depression, motivation, okay? And also decision making and problem solving. So what the literature is telling us, and this is just a very small summary of what the literature is telling us, that when we try to understand that link between sexual abuse and academic achievement, we look at these factors: the environment, we look at the biological impact of abuse. And we can see that each of us can find an area that we can contribute to. That when we think about how we can intervene, we can think about what is a targeted area, what area we're going to target in our interventions. So, just some implications for practice. Dr. Radok talked about education, and Dr. Maharaj talked about education. The importance of education within the curriculum, very important. And the toolkit is a brilliant addition to that. So we know that education, informing people about the signs and the symptoms of abuse, how to identify children who are at risk, how to question children, what to do in the case that you find out that the child has been abused, how to report, and for children themselves to know when they are in situations where they may be at risk, or what to do if you feel that you have been a victim of abuse. But within our support services, there is an opening for us to think about or to plan a program of intervention that includes what I think is important, early identification. So identifying families that we believe to be in at-risk situations, right? We are not saying that it's going to follow that there's going to be sexual abuse. We are saying that we want to reduce the risk factors and increase the protective factors. And I'm thinking about young mothers, for example, or people in very impoverished circumstances who need support, who may feel marginalized, who may feel isolated in some way. How do we provide them with the support they need, right? Whether it is financial advice, empowerment in some way, or even education on how to create an environment for their children that will help them grow intellectually. Because people just don't know that, right? So they would need that kind of guidance. Emotional support is also important. But I don't know if there are special education teachers here, but I do know that there are children in early childhood, teachers in early childhood. Early identification is important in this area as well. So if we identify that there are children who have been exposed to trauma or abuse, it is probably a good idea for us to include in our program early identification. That means early assessment. So we can identify whether the child is developing, is progressing as we would like them to progress. So use of screeners, psychologists' use of tests of intellectual ability, just to see how that child is developing, but also the design and the implementation of programs. So programs designed to improve or increase levels, and also enrichment activities. So not just focus on academics, but just sort of our exploration of the world, right? So to increase that child's exposure and stimulate the child intellectually. I just want to end by talking about the whole philosophy of inclusion. And you all know that we have adopted a policy of inclusion, and this is not only targeted to children with learning disabilities. This is targeted to children who may be at risk of marginalization in our system, exclusion, or children who are at risk of underachievement. So children who are, have been exposed to sexual abuse fall into this category. So we need to provide support, and we need to put all efforts into ensuring that they receive the best of our education system. Okay, so that is my contribution. I hope that you've learned something. Thank you.